All right. Good morning, everyone. By our clock here in Sacramento, it's 10 a.m., and so I'd like to welcome everyone. My name is Victoria Custodio, and I'm part of the Active Transportation Resource Center team. I'd like to thank you all for joining us for our teleconference/webinar this morning, which is entitled Understanding the Vision Behind Zero Traffic Fatality Frameworks. We're really thrilled and think we're going to have a great session this morning. As mentioned in our announcement, we know that a number of California cities have adopted Vision Zero policies and have been seeking state and regional ATP investments towards these platforms. At the same time, at the state level, we know that our lead transportation agencies have adopted a Towards Zero Death goal for many of their plans. So our purpose today is to launch a statewide public dialogue here in California about zero death frameworks for those who really have not yet been part of the discussion. We know that this will be the first of many, many important conversations on this topic. Next slide, please. But before we begin, I'd like to do a quick shout out for the ATRC if you're not already familiar with our activities. So the ATRC provides resources utilizing a combination of subject matter experts from Caltrans, who administers the project, and then they work with us, the California Department of Public Health, as well as other entities including California State University at Sacramento and other non-infrastructure safe routes to school and infrastructure engineering experts. And our main mission, we exist to support the Caltrans Active Transportation Program, and we do this through supporting the awardees at both the local and regional levels. Next slide, please. So today's speakers are absolutely wonderful, and we want to thank them in advance for being here. We're going to kick off our presentations with Leah Shaham, who is the founder and director of the Vision Zero Network, which is a national campaign supporting cities working towards Vision Zero, that is, zero traffic fatalities and severe injuries. The network helps communities develop and share best practices for safe mobility for all road users. And Leah has an extensive bio, but I'll just point out, because this is a teleconference for active transportation program stakeholders, that Leah actually used to be the executive director for the 10,000-member San Francisco Bicycle Coalition, which promotes bicycling for everyday transportation. Just picking from a very, very extensive and impressive resume. Leah's presentation is going to be entitled Vision Zero, Moving from Vision to Action. After Leah, we're going to hear from Megan Weir, who is the Director of the Program on Health, Equity, and Sustainability in the Environmental Health Branch at the San Francisco Department of Public Health, where she and her team work with local communities and government agencies to develop and apply innovative approaches to using health data and evidence to inform safe, sustainable, and equitable transportation and community development decisions in San Francisco. Ms. Weir co-chairs the San Francisco Citywide Vision Zero Task Force, which has been formed to eliminate traffic deaths and to oversee comprehensive collaborative data systems in support of evaluation, surveillance, monitoring, and analysis of San Francisco's data-driven, evidence-based transportation injury prevention initiatives. And again, my name is Victoria Custodio, and I'll be facilitating today. Next slide. As with all of our teleconferences and webinars, we have a few, we always set up some learning objectives, so you know what we're hoping you as participants will get out of the session. So they're very basic. We want to have you understand the fundamentals and principles of Vision Zero. We hope that you will learn how Vision Zero relates to and differs from traditional traffic safety approaches. And lastly, we want to, since this is a focused session for the ATP stakeholders across the state, we really want to look at how Vision Zero and ATP efforts have been strategically leveraged to advance both local and state active transportation safety goals. All right, and next slide. And then just one last slide as to why we're really addressing Vision Zero today, and so this hopefully will give you some context to the discussions that have led up to this session. So I have already mentioned that state State of California transportation and traffic safety agencies have integrated towards zero death into strategic management plans as well as into strategic highway safety plans. Vision Zero has primarily been an international and U.S. national and local city initiative to date, so we're really hoping that California can be, at the state level here at the State Department of Public Health in particular, really interested in how we can kind of learn more and understand what the framework is. Next, ATP funds local cities, including some who are co-branding their ATP-funded projects actually as Vision Zero efforts. So it's really important for all of us to kind of know, what each other is doing and how they actually are synergistic. And then lastly, I want to point out that there's been some recent California legislation that's been approved and signed by our governor. AB 2363 actually requires a new zero traffic fatalities task force, which will examine priorities and practices for legislative consideration around what works best for preventing traffic fatalities here in our state. So wanted to give that context, and keep on saying and, we actually want to do a quick poll of our attendees, and this is really to help. There's no sound, you guys. Is that not true? Okay, so sorry. All right. Get a little distracted here. I wanted to do a quick poll of attendees, and this is really to help our presenters know who's joining us today. So you should have in your WebEx access to a poll, which is opening right now. If you could complete that poll, it's on your bottom right-hand corner if you're not familiar with WebEx. And then Leah and Megan, I'll give you a quick update as to who we're seeing in the room. All right, are we going to, we have almost all of them completed? All right. Okay, I'm looking to see for, all right, we've got, is that 70%? About 68. Okay, all right. I think we're going to go with the 70% response rate, and I'll say that as far as percentage-wise, we have the majority are from within engineering. Thank you. We've got about 33% who work in engineering. We've got 26% who work in planning. We've got about 12% who are in public health, and then in law enforcement, we've got 1%. So hopefully that will allow you to know a little bit more who's in the audience. And on that note, I think I'd like to have Leah unmute her phone. And
great. Hi, everybody. This is Leah Shaham with the Vision Zero Network. Thanks so much for the introduction and for the chance to be here, Victoria. That's great. I appreciate it.
Appreciate it.
Super.
All right. We're going to switch over to Leah's slides.
Great.
Make sure it's not Megan's. Are they integrated?
We're integrated.
Okay. All right. Can you, and Megan, sorry, Leah, at this point you should have the controls?
Yes, I think so. That's great. So you should see my slide called Vision Zero, moving from vision to action, right?
Correct. Okay. Straight from here.
Super, thanks. So again, my name is Leah Shaham, and our group, real quickly, is a nonprofit. I'll share that. The Vision Zero Network, we started just about 3 years ago. I'm actually based in San Francisco, so right here in California, but working across the nation, and I'll share more about our work. Really, our mission is helping promote and advance the goal of Vision Zero, of zero traffic deaths for all road users. And I'll just give a shout out. We're really fortunate that our initial funding to get started is from Kaiser Permanente right here in California from the public health realm. So I know that, great, I'm just getting ready to go here. I probably don't need to tell this group the scope of the problem. Here we go, thank you. You should see a slide or an image there with a graph that sadly could be updated to show even worse numbers, but I probably don't need to tell the group on this call that we have what I would call a public health crisis in this country. Last year, there were about 40,000 traffic deaths in the U.S., millions of injuries. Unfortunately, any number obviously is terrible, but we've been going up the last few years. That number had been trending down since the 80s nationally and worldwide, but unfortunately the last few years we've been trending back up. I also probably don't need to tell you all that that number and this unfortunate reality is particularly hard-hitting for those walking and biking in certain communities, which we'll talk more about. So just to put this in perspective a little bit, you know, other issues that get a lot of attention and deservedly so, issues around the opioid crisis and gun violence. The numbers of deaths every year in this country are quite similar in all those areas. Yet historically we've taken a really different approach, I would say, to the traffic safety issue, and that's what we're going to talk about a little bit here. Hopefully you should see a map there, and you can see the green dots showing all the communities that we know of. There may be more, but the ones that we've connected with across the country. This is more than 30 U.S. communities who've committed to the goal of Vision Zero. And let me be clear about that. That's a case where their mayor or top elected official has publicly committed to the goal of zero traffic deaths among all road users in a set time frame, where there's a Vision Zero plan or strategy in place or is in the works, and where key departments are involved. And when I say key departments, I will highlight what we consider the 4 critical departments. That is, of course, transportation, public health, police department, and mayor's office. There are certainly many, many, many more important additional important players, but we really consider that the crux. And I'll highlight that that's one of the big differences we're seeing, particularly at the local level in terms of the Vision Zero approach, is a much deeper and I'd say more institutionalized, cross-departmental or multi-sector approach to this work, which we'll talk a little bit about. I do want to give credit real quickly. First of all, a shout out to California. You'll see more dots there, or more cities having committed than any other state. And we're really proud of the leadership that's being shown in California. To give credit, New York City was the first U.S. city to commit to Vision Zero just about 4 years ago, so not very long at all. San Francisco became the second, followed pretty soon after by places like San Jose and Fremont, LA, San Diego. So again, a lot of activity in California. And just to quickly share some numbers, the 2 longest running or earliest adopting Vision Zero communities in the U.S. have been showing good success. In their first 4 years, New York City saw 28% fewer traffic deaths in 4 years after it committed and started working on Vision Zero, and San Francisco saw about a 40% decrease. This is really early on. We don't want to make too much of those numbers, but these are encouraging signs. So I'm going to walk through today really what we consider the differences between Vision Zero and the traditional traffic safety approach. And let me start by saying this is not at all to dismiss the merits and value of the traditional approach, but really to show how what we hope we're doing in the Vision Zero community is building on that and evolving. What we want to really emphasize here, and I'll say a lot of my job, is helping people understand that Vision Zero is not just a good idea or kind of a great slogan or a great tagline. It's actually a transformative shift. It's a different way of approaching the problem. So here are kind of the key points I'm going to walk through today, and starting with this top one, acknowledging that traffic losses are preventable. And that sounds really basic, but it's a really core element or fundamental difference to how Vision Zero is different than the traditional traffic safety approach. And I'll just amplify that by talking about the language quickly here. I know before a few years ago, I definitely used the phrase traffic accident all the time. I still hear it on the radio every morning. You hear it in the newspaper. Most people call these traffic accidents without thinking about it and, without much real judgment or consciousness there. But I'll just say, if there's one idea I leave you with today, let it be this one, that the more we frame these issues, problems, challenges as accidents, the more we really kind of take our agency out of it. We take our control out of it. And really what we're trying to do with the work of Vision Zero is really help emphasize that these injuries, these serious problems, deaths, are preventable and that there are ways that we can systematically address and prevent these serious problems, which we'll talk about. So even the language we use, part of our mantra is really helping people shift their language. And I'm really impressed, for instance, here in San Francisco, I know everyone from the police chief to the mayor to community groups to the key departments involved, including our transportation and public health departments, have officially shifted their language from traffic accident to traffic crash. That's everything from police reports to the way they talk about this in the media, et cetera. So, you know, language is, I know words are just words, but it really does send a message. So I'll just kind of leave that image with you. But starting with that base that these losses are preventable. So how do we prevent them? Really, I'd say the biggest difference with Vision Zero, in addition to thinking about these problems being preventable, is that we take a systems approach to prevention. And I want to give a shout out to all the public health folks on the call because we're learning so much from you. I know I am. And we're sharing this image, the spectrum of prevention, and credit to the Prevention Institute for developing and sharing this. And I know a lot of you all in the public health field use this, and we're really encouraging more of this approach in the traffic safety world. So what this is really showing are all very important areas of prevention. I would say my experience that we've spent a lot more time and energy and resources on those bottom areas, strengthening individual knowledge, promoting community education, really helping individuals understand their responsibilities and what they can do and should do to keep themselves safe. And let me just pause and say that is very important and we need to keep doing that. But to make real change, to move away from our current situation of, again, 40,000 traffic deaths a year in this country, that's 100 every single day, we need to be working more at the upstream level, the systems level, which is influencing policy and legislation and changing organizational practices. So an example in this world of changing organizational practices that obviously folks on this call probably relate to very much is our street design, right? How are we designing streets in a way that encourage safe behavior versus discourage safe behavior? I won't go too much further than that right now. We'll come back to that. In this next image, I really want to share to give credit to our allies in Sweden who really have come up with the idea of Vision Zero. This is a really basic thought, but part of the concept of Vision Zero, again, is that these traffic deaths and serious injuries are preventable, but also, frankly, that it is our responsibility, our ethical responsibility to ensure safe mobility for people, to ensure that people don't die or dramatically lessen their lives simply while trying to get to school, to work, to the park. So part of the way we do this is, again, this systems approach. If you think about that bottom right corner where it says road users, imagine not just a driver there, but maybe someone walking, someone biking, taking transit. Individual road users need to be responsible for following the rules of the road. That is true and should always be true. But what Vision Zero does is really say, hey, let's be honest, humans are fallible. They're not always going to make the right decisions, or sometimes they make mistakes, whether intentional or not. So on the left side, you'll see that road users fail to comply. Let's be honest about that and let's acknowledge that. Let's not pretend like that's not true. And if that is the case, which it is, then we look back up to the top there to system designers, and I would add their policymakers really, to help us design the systems and the policies in ways that those inevitable mistakes, i.e. crashes, do not end up in deaths or severe injuries. So I'll just pause and say something to clarify is that Vision Zero is not claiming that we can stop all crashes. Even I, who's a pretty optimistic person, wouldn't say that that's possible because people make mistakes and we're going to have crashes. But if we can lessen the severity of those crashes, we're going to be in much better shape. So another way, how do we do this, is by being more data-driven. Again, this is not a new idea. I really want to acknowledge that we're building on, decades and generations of work from folks, frankly, way smarter than me in this field who have been using data to do their work and to really figure out how to make our roadways safer for all users. But today, I'd say thanks to technology, thanks to a lot of different things, and again, thanks to our friends in the public health field, I think we're doing a better job and being smarter about using that data and having more data and focusing on that data. Here's just a couple quick snapshots from 3 different cities. You'll see LA, San Francisco, and Denver. I know Megan's going to talk about San Francisco, so I won't go there, but let me just share, for instance, Denver, 50% of all traffic fatalities happen on just 5% of streets. What this is showing, let me pause and say that this is the case in almost every city we're working in. If I went back to that map, you'd see that almost every dot has some figures like this that are disproportionately showing that a relatively small number of streets account for a relatively large number of problems. While that might be discouraging to some, it's actually pretty empowering because we know where our limited resources can go. And I know for all of us, whether you're the city, regional, or state level, we all have limited resources. So how do we use this data to really focus our limited resources best? Another area where I'd say the emphasis on data and the greater embrace on data is helping is really thinking about how not just geographically, but in other ways, our communities have not been, I would say, all treated equally or equitably over time. These are national statistics. Let me clarify that. But what you'll see here is, according to national statistics from a few years ago, admittedly here, that we see that people in low-income communities are twice as likely to be killed while walking. African American and Latino people in America are twice as likely to be killed while walking. And communities with sidewalks, much more likely to have sidewalks in high-income than low-income communities. You could say the same thing about bikeways, by the way. You have that same disproportionate impact. Similarly, you also have more fast, high-speed arterials, freeway touchdowns, roads with higher crash rates in low-income communities. So really what I'm showing here probably won't surprise, again, folks on the call, but what it's doing is I think really helping highlight that, over many, many decades and generations, we've built a certain type of infrastructure and community that has really not been equitable to all our communities. So we need to, again, use our resources, and they are limited, to really try and help bring these communities up to a safe level. And I'll quickly mention that one key tenet of Vision Zero is really thinking about, again, how to do this through safe systems, not more traffic stops. There is certainly a role for enforcement, and we're really excited about the collaboration in so many communities with law enforcement. But Vision Zero doesn't mean, hey, let's just write more tickets. Practically speaking, we know there's not enough law enforcement to do that, and they have a lot of demands on their time and energy, so that's not practically speaking. Secondly, we know in a lot of our communities we're not in a good place to do that in terms of trust building with the community, and that traffic stops can really be an area where there can be challenges with the community, especially communities of color. So I won't go into this too much more, but it's an area where we're really thinking about the equity impacts of all our work, including the enforcement piece, which really leads into this second to last piece, that not all E's are created equal. And I'm sure folks on the call know the traditional E's of engineering, education, enforcement, evaluation, emergency medical services. More and more we're promoting equity and engagement, a lot of us. There's so many E's, and they're all important E's. But I think a lot of us have felt that the E's have been a little more siloed than ideal, not by intent or intention, but rather just reality. So we're really thinking about how do we kind of reframe all the important work and think about these goals in some different ways you'll see here, such as safe streets, speeds, vehicles, and safe people, all important pieces. And when we think about the E's, now I'm going back to the E's, but when we think about those areas, Vision Zero really focuses on the roadway redesign, so really the engineering aspects. How do we design these roads in ways, redesign often, especially in our cities, how do we redesign in ways that encourage good behavior or safe behavior, and also managing speed. So kind of showing a before and after here of dedicating space. What you don't see here is more pedestrian crossing time for people walking. You do see fewer auto travel lanes, so less risk while crossing, and obviously a separated bikeway there. I'm going to show a quick picture of a few maybe not to do images. And this is from my hometown of Jacksonville, Florida, where I grew up, right outside my parents' house. Lovely neighborhood, and lovely to see children walking to school. These kids are walking to school. It's about a 3-block walk to the middle school. They do not have a sidewalk. So just an example here where and by the way, it looks like a calm street, but people really drive surprisingly fast down this street in the morning commute. So could we help these kids by educating or enforcing? I would say no, because they do not have a good choice to begin with. So it's a really kind of maybe obvious example of if we don't build it right the first time, we really can't, or come in and build it safely, having sidewalks for these kids to walk on, we really can't expect them to be illustrating safe behavior. So thinking about safe routes to school and wonderful programs like that, we've got to make sure people have safe choices, good choices for healthy activities such as walking and biking and particularly walking to transit. We can't educate and enforce our way out of those problems if we don't build it the way that we should and could. Another picture here from Jacksonville, Florida. It's a little hard to see, but this woman's pushing a stroller. I know this area well. She would have to walk about 3/4 of a mile to get to a crosswalk, so not surprising that she's not doing that. And pretty clear, not a really good choice here for this. This looks like a gentleman bicycling. So we know not every community can look perfect, but we really are aiming for how do we build complete streets. If we're asking people to be safe while walking, biking, driving, and taking transit, they need safe space to do that. And then the last piece I'll cover is really speed management. And I know Megan's going to talk more on that. We're really excited that across the nation, this is getting more attention. We all know probably some version. There's different versions of this chart showing that, simply put, it's the speed that kills. If I'm walking and I'm hit by a car moving at 20 miles per hour, the average person, this is obviously an average, has a 90% chance of survival. At 40 miles per hour, your odds swap completely and a 90% chance of death. Those are pretty startling numbers. So think about your community, especially if it's a community where you are actively encouraging walking and biking, you're actively encouraging people to get to a transit stop. It really matters a lot how we manage that speed, because someone being hit by a car, sadly, it is going to happen, crashes happen, but someone getting hit by a car at a lower speed is far more likely to survive. It's that simple. So we're really promoting these areas. Again, not new areas. These are, it's not a new toolkit we're inventing here. It's really just emphasizing, I'd say, the tools that are best proven, that have really been proven across the world. So designing streets for safe speed, setting safe speed limits, and using automated speed enforcement in a thoughtful and equitable and data-driven way. I want to give a shout out to Fremont, California. We are really happy to see, more I'd say mid-sized communities and more, suburban designed communities like Fremont take a lead here, and they're doing a really great job with their Vision Zero effort. This image is showing it. It's not very clear, but it used to be a 2-lane road. They made that a 1-lane road, a pretty narrow travel lane, and added a bike lane with a painted buffer. And what they've seen is not only do they have dedicated space for people biking, which was one goal, they've significantly lowered travel speeds for the drivers. So it's a safer road for everyone, those driving, walking, and biking. And as I understand, there's a real problem with senior pedestrian safety in terms of the streets in Fremont. A lot of emphasis is put on highways around speeds, but I think this is a great graph from the Insurance Institute for Highway Safety, a national group, showing that it's actually local roads where we're having most of our problems with traffic fatalities related to speed. And I want to give a shout out places like New York City that are using automated speed enforcement, places like Washington, D.C., now places like Seattle and Portland. A growing number of cities in the U.S. are testing and using safety cameras or speed cameras and seeing tremendous benefits there. I won't go into that too much more, but it is a proven measure that works. And then finally, I'm going to round up with, as I said, none of these tools are, I would say none of them are really new. It's really about building the political will, the public will and support, and really the institutional collaboration and commitment to shift our thinking to a systems approach and to really coordinate the work better. And I want to give a shout out to Los Angeles. A lot of people think of LA as a particularly challenging place in terms of traffic safety. Obviously it's a reputation as very, heavy auto-centric. They have set the goal of Vision Zero, and it's, not surprisingly, it's a heavy lift, but they're making real changes in their designs and their streets. And then lastly, I just want to cover quickly the federal level. This is not just a California issue. It's not just a local issue. We're seeing real stepped up discussion and commitment at the national level. This is a new report, report released earlier this year, I should say, called The Road to Zero. It was led by the National Safety Council and the RAND Corporation in partnership with the U.S. Department of Transportation, and there's about 200 groups that are members of this group. But it really focuses on the safe systems approach. If you haven't seen this report yet, check it out. And here are the kind of areas it focuses on. these major areas of double down on what works. Like I said, the toolbox is out there. We know what works to manage speed. Let's win the political will and the public support to implement those things. Of course, accelerate advanced technology. We know there's so much more potential, and we need to make sure that we help focus technology on safety measures. And then prioritize safety. That sounds really basic, right? But again, a shout out, we're really picking up from the public health community, similar to a health in all policies approach. More and more we're seeing the traffic safety world focus on a safety in all policies approach, which is what it's going to take. You know, and in the end, it really comes down to, you know, how we prioritize mobility. Of course, we all want to make sure folks have good mobility choices, walking, biking, taking transit, and of course driving is an option, but we want to make sure that people can do that safely. And I will wind down with my contact information here. We hope you'll follow us at the Vision Zero Network and get involved with our work. Thank you so much, and I'll hand it back over to you, Victoria.
Thank you, Leah. That was incredible, and so we're so pleased with your presentation. We have a couple of questions that we'd like to take before we hand it the mouse over to Megan. So the first one is looking at Vision Zero cities at the Vision Zero cities map. Is there a consistent time frame across the participating cities for reducing, eliminating fatalities, for example, by 2030? Or does the planning timeline modulate according to the context?
Great question, yes. There is not a consistent time frame. It really is driven by the community itself, which I think is appropriate. Communities are in different places, right, with where they are in the work and what they need to be doing. A lot of communities are choosing the 10-year time frame. Some are choosing a little further out. Maybe it's 12 or 15 years. It's really up to them. And I'll say, obviously, we all agree the sooner the better, of course, but I think I'll emphasize that the idea or the point of having an end goal or that public, and that's important that it be public timeline, is really important because I would say it adds urgency to the work happening, and it really emphasizes or reemphasizes that point I made about, hey, these serious problems are preventable. You know, as with many other issues of disease or gun violence or important things that we want to improve upon, you know, communities come together and say, we're going to improve, we're going to eradicate this. We're going to make sure that this problem is solved. That's really what we're saying, and we're going to do it in a set time frame. But communities choose that themselves.
Excellent. We have a bunch of questions that are rolling in, but I do want to make sure that Megan has enough time for her presentation. We're going to hold off. I feel like the other questions that are coming in might in part be answered by some of the things that Megan's going to talk about. So if we could turn the mouse over to Megan. You ready, Megan?
Got it. Thank you.
All right. All right. Thanks again, Leah, and take it away, Megan.
Thanks so much, Victoria. It's really a pleasure to be here today to share some of our work in San Francisco as kind of a case study of Vision Zero, and thanks to Leah for the great national overview and introduction in our leadership, and again, Victoria, for this opportunity. I've had the honor of co-chairing Vision Zero in San Francisco since it was adopted in 2014 and work really closely on a daily basis to help realize our goals with my team, with the SFMTA, with our police department, with a host of other city agencies, as well as our community stakeholders. In addition to co-chairing Vision Zero, I also lead our city's data systems work to support Vision Zero. And in San Francisco, traffic injury has really been a historic public health problem. In previous years, we had approximately 30 fatalities per year, with another 500 people hospitalized with severe injuries annually in our public hospital. Zuckerberg San Francisco General Hospital is also a really close partner with our team for Vision Zero, and through that work, we've found approximately $35 million in medical costs alone are accrued each year at our hospital. And on average, our city trauma surgeons are responding to a serious traffic injury every 17 hours. Even they were surprised to find that about half of the people that are treated at our city's Level 1 Trauma Center are people injured in traffic collisions. Sophia Liu was crossing at a crosswalk with her mother on New Year's Eve in 2013 and tragically became the 6th pedestrian fatality that month. San Francisco had, historically prioritized safety, but through the leadership of our community advocates, and in partnership with our elected officials at that point in time, San Francisco really took notice and rose to respond to say that no more deaths are acceptable. The only acceptable goal for traffic fatalities in San Francisco is zero. And in early 2014, San Francisco adopted Vision Zero as our city policy with strong leadership from Mayor Lee and our department heads, and in partnership both with our community stakeholders and city agency. Vision Zero is our city's commitment to creating safer and more livable streets with the goal of both eliminating traffic fatalities as well as reducing severe injuries. Last year in 2017, we saw the lowest number of traffic deaths in over 100 years of recorded history in San Francisco. That was 20 fatalities. We also saw a downward trend for pedestrian deaths since 2014. While this is encouraging, still 20 deaths is far too many, and we have a lot of work to do. To better understand, traffic deaths in San Francisco, about last year 70% were to people walking. So the intersection with respect to active transportation and Vision Zero is really apparent in our fatality statistics. Also, half of those killed while walking were seniors. Leading violations in those fatalities were both unsafe speed and drivers failing to yield to pedestrians. And these fatalities were also concentrated in our city's high injury network, which I'll talk about more. In San Francisco, our Vision Zero work is really organized, consistent with the safe systems approach that Leah shared in her presentation. At the bottom, we see the three pillars of leading really the tip of our spear with safe streets and re-engineering our streets to be complete streets, and also providing traffic calming in our neighborhoods. Safe people, including a number of engagement, education, and enforcement actions to support safe people, and also increasingly focusing on safe vehicles and using technology to ensure that we have a safe system. Coming up from the bottom of that, both our data systems and our legislative agenda really support this broader approach to Vision Zero. And at the top, we report quarterly both to our Mayor's Community and City Vision Zero Task Force, which meets in City Hall and is open to the public, as well as our Transportation Authority's Vision Zero Committee. Again, the core principles of Vision Zero are principles that we strongly adhere to in San Francisco, and that of really focusing on prevention and also saving lives and reducing the most severe health impacts of traffic fatalities. We also have a strong focus on equity, so ensuring that our traffic safety improvements are protecting our most vulnerable people on our streets. And again, safe streets, safe people and vehicles, and finally, a real focus on speed is core to Vision Zero, and that's because speed, of course, as Leah, to replicate Leah's slides, is really a major predictor of whether or not someone survives a crash, particularly for our most vulnerable people walking and biking. So in order to inform our city's Vision Zero efforts and ensure that we're able to target our limited resources efficiently, our team works with the MTA, the Police Department, Planning, DPW, and other city agencies to link our injury data to other data on our transportation network, land use factors, sociodemographic factors in this database. For those of you who are data-minded, it's a publicly available database, transbasesf.org, which is really a backbone of some of the analyses that I'm about to share. We've also invested in creating a comprehensive injury surveillance system for monitoring, evaluation, and analysis of our transportation-related injuries. While on the left, standard practice has often, in most jurisdictions, is focusing on police-reported injury collisions, we know from past analyses and current analyses in San Francisco that this approach contributes to some underreporting of injuries, including to pedestrians and cyclists, as well as in San Francisco to African Americans. And so to address this underreporting issue and to also improve our injury severity assessment and have data on other factors that could help us target our injury prevention initiatives, we have completed the linkage of 3 years of police, hospital, and ambulance data to inform our Vision Zero efforts. The first application of this linked data was to refresh our city's high injury network, which, as Leah mentioned, is our network of city streets where our severe and fatal injuries are most concentrated. So this map in blue, you can see that 13% of our city's street miles, where approximately 75% of severe and fatal injuries to all modes are concentrated. On this map, it's important to note that about 28% were records that were only identifiable in hospital data. So we work with our city family partners to help focus improvements on our high injury network, again, ultimately to save lives and reduce injury severity. In 2017, the city completed almost 34 miles of engineering improvements on our city's high injury network. And importantly, a number of those capital improvements were supported by the Active Transportation Program, including improvements on Powell Street in our Union Square area, signalization on Geneva, and ATP is also a really important funding source for improvements on our Van Ness Bus Rapid Transit program, which is making significant safety improvements on a really critical transportation corridor in San Francisco. Active Transportation Program funding also supported our Safe Speeds education and enforcement campaign. And as many of you are probably aware, speed is often a critical barrier to people feeling safe walking and biking in cities and areas. And so this campaign really leveraged ATP funding to address both speed as a barrier to walking and biking, and also speed as an important predictor of injury. We used our high injury network to identify high injury corridors where speed was a contributing factor to injuries to people walking and biking, and worked closely across the city to focus both targeted enforcement as well as education campaigns. You can see the ad on the back of the bus, and there are other types of media and community engagement that were a part of this campaign. Focusing improvements on our high injury network has also really helped raise awareness of intersections. Again, as Leah mentioned, with respect to equity and where we see injury disparities. So this map is the yellow mustard color on the map is our communities of concern in San Francisco, and that's where we have concentrations of low-income communities, communities of color, seniors, and other vulnerable populations. And while those communities comprise about a third of our surface streets, half of our high injury network is concentrated in those communities. So using the high injury network for prioritization is also helping address some of these historic injury inequities. In doing so, it's also, through Vision Zero, helped raise our awareness of the importance to really go deeper with respect to community engagement, to address injury inequities, and also to reach populations that might not be typically reached through typical engagement strategies. So this slide depicts a recent project on Taylor Street that was actually just passed by our SFMTA board, and it used some tactical urbanism and other community engagement strategies to really meet people where they were in their daily lives to help understand and inform project improvements. Of course, Safe Routes to School is a critical program and important program across many jurisdictions in California. In San Francisco, non-infrastructure ATP funding supports activities such as task forces, walking school buses, bike riding classes for youth, a program in our Tenderloin community to ensure safe passage of youth to their schools, after-school city streets investigators, and bicycle education. And of course, youth are critical to culture change. Safe Routes to School is really important, both in advancing that active transportation, but as well as educating youth around safety to help inform the culture change that we will really need to realize Vision Zero. And this slide depicts our recent Walk to School Day with Mayor Breed and the debut of our Vision Zero capes, which we're really excited to see running around on the playground. Of course, another critical vulnerable population for Vision Zero are seniors. And in San Francisco, and you know, these are patterns across the country, seniors are much more vulnerable to severe and fatal injury. In San Francisco, they are 5 times more likely to die relative to younger pedestrians. We also know that the average death risk for seniors is much higher at lower speeds than for younger adults. In San Francisco, we also have really benefited from historic engagement with the disability community, including our Mayor's Office of Disability, as well as other advocates who've really helped elevate the importance of people with disabilities and those considerations in our traffic safety conversations. Through the work with the hospital, we were able to access data for the first time on people with disabilities that are injured, and found approximately 6% of people were recorded as having a mobility, visual, or hearing disability in our hospital safety data. This, of course, is probably a really conservative estimate. Those are very limited, you know, disability categories, but I think help us begin to develop more of an understanding of these issues. Of those people injured, most of them were using a mobility aid and were walking, and over half were seniors aged 65 and older. SFDPH has a Safe Streets for Seniors program that focuses on education and community engagement of seniors, given that, you know, this important traffic safety issues. It includes multilingual presentations to seniors and service providers, as well as funding for community-based organizations to advocate around issues of particular concern, and have so far reached over 1,300 seniors and staff. As a result of some of the education outreach work, SFMTA made a policy change this year to increase pedestrian crossing time at intersections citywide, not having enough time to cross being a real critical issue that seniors were raising with the SFMTA. DPH this year also completed the map depicted on this slide, looking at where are seniors and people with disabilities injured. And this is really another tool that kind of complements our high injury network. And what you can see on this slide is both the injury segments where people were injured, but also what we're calling priority areas. And these are areas where seniors and people with disabilities live, or where they frequently travel. And that can be to health clinics, meal centers, paratransit, and other critical locations. So this is another tool that we're sharing with our collaborators around the city to help prioritize improvements that could save lives and reduce injury for seniors. This map also informed our district attorney's senior safety campaign, which was launched on corridors citywide, and is informing an upcoming traffic calming program by the SFMTA. Leah touched on automated speed enforcement, automated speed enforcement has been our top state legislative priority for Vision Zero, and that's because in the 142 communities and 15 states where it is legal, which does not include California, there's a strong body of evidence that it really works. For example, Portland seeing over 50% reduction in fatalities after its introduction, as well as in other cities seeing some really important benchmarks with respect to the impact of automated speed enforcement on slowing speeds and ultimately reducing risk for severe and fatal injuries. This image is actually in the lobby of Zuckerberg San Francisco General Hospital, where Mayor Lee, Assemblyman David Chu, our police, transportation, public health, and our families announced AB 342, which was legislation to authorize a pilot of automated speed enforcement in San Francisco and San Jose. That legislation has unfortunately not advanced at the state level, but because of its effectiveness, and we know it's a critical force multiplier for our local police with respect to slowing speeds, it continues to be a top priority for our Vision Zero initiative. I just wanted to conclude, sharing more about our San Francisco Bay Area Families for Safe Streets. These are families who have lost a loved one on the streets of San Francisco or another Bay Area city. They are really important partners for our Vision Zero effort. They're an important holding us accountable and really reminding us of what the ultimate impacts are of this work. We coordinate in San Francisco a crisis response that was in response to the request from the Bay Area Families for Safe Streets that reaches out to the families of everyone who has lost a loved one to provide critical financial, social, and other support to families in the immediate hours and days following the loss of a loved one. But also our families really work to keep in mind the long view and the vision of Vision Zero, which is that no one experiences the death of their family, a family member, of their neighbor, of their coworker. A reminder that Vision Zero, we're really talking about ourselves. And for Vision Zero in San Francisco, as we work to develop our next action strategy, we also know that we have a lot more work to do. And so I just wanted to, again, thank Victoria for the opportunity to speak today. We have a lot more work to do, and we need a lot more partners to realize Vision Zero, and look forward to continuing this conversation. Of course, I have a lot of people to acknowledge, and again, thank you.
Thank you so much, Megan. That was wonderful, and just grateful that you're able to give this presentation to our statewide audience. We have a tremendous number of questions rolling in, so I want to acknowledge that when we put out the announcement, when we had kind of said that we were going to finish up at 11, our team here is willing to go longer just to be able to accommodate the questions. If you guys are able to stay on the phone with us, but for those of you that need to get off at 11, you know, we'll make sure that there's this is recorded and posted and shared with everyone who's registered, and we'll see what we can do also with kind of sharing the questions that might not have, you know, the responses that we won't have written out. But if that works for everyone, that's our plan in the room. Okay.
It's for Leah and I.
Perfect. Okay, so let's start because, and I want to just bring us back a little bit to our active transportation focus here. And so the first question is that comes in, and it says, we're interested in Vision Zero, but concerned that it might discourage more bike and ped routes rather than encourage because they increase the risk. Have you seen this conflict elsewhere, and how is it being addressed? So I'll let you guys decide who wants to take it.
Sure. Hey, this is Leah Shayan with the Vision Zero Network. Again, you know, I'll be honest, that was I think, really important question and a prominent question on my mind too. About 4 or 5 years ago, I think more, you know, from the perspective of, hey, if we talk about this worry of safety too much, are we going to discourage people from these activities, especially biking, I think, right? That's sometimes the one that, you know, is connected more, but walking as well. But I think especially biking, you know, I have been really pleasantly surprised that that has not borne out. And just my kind of personal take on that is that, you know, let's be real, that the realities are the realities, perceptions are often reality. If people don't feel safe, if they don't feel comfortable, they're not going to choose a certain mode like biking and walking. So, you know, from our perspective, I think the best thing we can be doing to encourage biking and walking is improving the safety and being honest and talking about it. You know, it's much safer than many people think to bike and walk, but it's still not as good as it should be, and we need to focus on that. So, you know, I think it was something that we worried about perception-wise, and across the country really hasn't caused a problem in discouraging, in my estimation, but good to think about.
Yeah, I thank you, Leah, for your nationwide perspective, and I think from an equity perspective, it's just also important to note that, you know, for example, in San Francisco, our high entry network is really concentrated in some of our most active communities. So, you know, I kind of thought of it almost as a canary in the coal mine with respect to our Chinatown communities, the Tenderloin, South of Market areas where we have the most active transportation users are where we're seeing the biggest opportunity for improvements. And so Vision Zero is actually really responsive to these historic community concerns in some of our most active communities.
Excellent. Great. I'm going to just get to the next question. since we have a number of engineers who are listening in, how do you respond to the traditional 85th percentile argument that most traffic engineers use in lowering speeds or setting speeds? What's the kind of Vision Zero approach to speed setting?
So glad that you raised that question. First of all, I'll refer to a really important report that was put out last summer. I should have mentioned this, by the National Transportation Safety Board. Obviously, it's a federal group. It's an independent agency that is the leading traffic safety agency in the country. The National Transportation Safety Board, the NTSB, did a really comprehensive study of the issue of speed. I'd recommend people check it out. One of their primary and very clear recommendations is to modernize that standard of setting speeds. They acknowledge explicitly that the 85th percentile rule, and if I won't get into too much of that, but basically, very pared down, it's kind of taking the reality. What's happening out there? What speed are 85% of folks going? And that's kind of the common speed. That's how we'll set speed limits. I'm oversimplifying that, but that's the general gist of it. But this study by the NTSB showed that that was very much out of date and not really staying up with best practices. It was something that was literally designed in, I think it was either the 40s or 50s, in a rural environment when things were very different on our streets. So what the NTSB recommends, and what we're seeing more and more, I'd say, national leaders, particularly in the world of engineering, move towards, is a safe systems approach to setting speed limits. The 85th percentile is still a factor in there, but what is recommended is a much stronger consideration of road users. For instance, are people walking and biking likely to be present? So, that's most local communities or most city environments, different, say, than a big interstate system or such. So are people walking and biking present or likely to be present? Do we want them to be present? What's the land use? What's the context? What's the crash and injury history? Those things are much bigger or more prominent factors in this safe systems approach. So for you engineers on the call, it's pretty exciting news that, in my opinion, that we're seeing the National Uniform Traffic Control Device Committee, that's a mouthful, the NUTCD, explicitly analyzing and offering up some changes to the speed setting standards. I think we're going to be hearing a lot more about that early next year. You'll also see groups like the Institute of Transportation Engineers offering some, I'd say, updates in thinking and approach to this. If folks are interested kind of on the here and now level, please check out our website. Portland, Oregon, I'd say, is the leader in this area, where they have, as a city, a Vision Zero city, worked with their state, their Oregon Department of Transportation, to gain more flexibility in how speeds are set at the local level, with an emphasis on safety and with an emphasis on road users who are more vulnerable walking and biking. And they're doing that, and they're showing great results. So you can learn more about Portland's experience on our website. Thanks.
Perfect, Leah. And just so you know, the ATRC, we will do some follow-up correspondences with those that have registered and participated in this call today, and send some links out to the actual National Transportation Safety Board report, just so that you don't have to search it out for yourself. And I'm sure that report is going to be central to some of the discussions to that task force that I mentioned earlier, the statewide task force that I mentioned earlier. So I have a big picture question for you, and maybe both of you can answer this. So this one comes in, it says, our city council considered endorsing a Vision Zero support statement, but failed to do so when it was unclear what the budgetary implications would be. Can you just kind of comment on how to think about the financial implications and considerations in advance of adoption?
Sure, real briefly, and then I'll hand it to Megan for more of the on-the-ground experience. I think it's important to emphasize the first, dozen or so communities we worked with that committed to Vision Zero did not start with a new funding pot. I mean, if you have a new funding pot, wonderful, great, good for you. But one doesn't need to be waiting for a new source of funds to do this, because it's really about prioritizing existing resources to begin with. But I'll hand it over to Megan, because they've done a really good job, I think, on this funding question.
I mean, I think that, yes, when we adopted Vision Zero, there wasn't, new funding that was allocated. We did have, a strong foundation. We previously had a pedestrian safety task force, so I feel like the organization and the city agencies having the coordination, and being able to meet around Vision Zero and having that pre-existing collaboration really helped set us up for success. So I think, for jurisdictions that may be facing some of these budgetary challenges, kind of doing what can be done with respect to developing cross-agency relationships between, transportation, public health, the police department to really lay the foundation is really helpful. And then, once Vision Zero was adopted, I think, definitely in developing an action strategy, some of the near-term actions really help set you up for the more pragmatic, budgetary discussions, be it reallocating resources or, resources for coordination and communications to things that are often not given enough attention as may be needed in budgetary decisions.
Right. That's a great, I think that's great. And I want to also say that, again, reinforce the fact that this is just starting the dialogue. I've been in touch with Megan quite frequently since I first met her at the Transportation Research Board meeting earlier in 2018, and it's just been a huge learning curve for us, and she's been absolutely wonderful, in terms of sharing the resources and wisdom that they've gathered from being an early adopter of Vision Zero. So I think the state's really going to benefit from the efforts of San Francisco, and I would say, Leah at the national level, but then the California cities. It's been a really nice dialogue today, and I just want to say that we really appreciate your expertise. Again, I've been saying that every time I've talked to these two. So, but it's true. I think we can do one more question because I do have some closing slides that I want to just share with you, and there is also an evaluation that we'll ask you guys to do. But this last question, and this is kind of looking ahead and understanding there's a lot of new mobility options out there and that we're in this paradigm shift. How do you see Vision Zero integrating with increased shared mobility options such as e-scooters, and then others we know of, which provide effective transport, but maybe also increase the risk for injury? So
that's a great question. In San Francisco, we definitely, as we work towards Vision Zero, as new mobility options, emerge from a range of different types of mobility options, be they, e-scooters, autonomous vehicles, other things, we're really mindful of the opportunity for either to help advance Vision Zero and realize our goals, or adding additional concerns regarding injury risk. So to that effort, my team here at DPH has been working really closely with the trauma surgeons at Zuckerberg San Francisco General Hospital, emergency responders, the police department, and our SFMTA to develop new surveillance tracking that we'll be doing through our trauma registry to start collecting data that hasn't historically been collected on emerging mobility modes. So developing a new taxonomy that is now being used at the trauma center to assess injury patterns, and then also working with the police department and the MTA's data collection tools so that we can really monitor, assess, and address emerging issues with respect to injury and Vision Zero implications.
That is excellent, Megan. I know that there are a number of questions that we haven't been able to get to today, but what we'll do is we'll work with our speakers to actually get the answers. And I just have a few closing slides for those of us that are still on the call, and I appreciate your willingness to kind of stay beyond the initially set limits to kind of really get at some important discussions that and learning. So yeah, so So I wanted to just point out that if you're interested in reading about the legislation, there's a website where you can do a quick bill search and enter AB 2363. It's just worth a read so that you actually can see what was actually approved. Next slide. And we will be doing a survey for those participants today to get your feedback, and we'll also be asking questions if you have interest in receiving additional technical assistance from our resource center. Next slide. Just a reminder, we have a robust website with some existing resources and lists of different trainings that the ATRC is doing, both virtually and then in person in coordination with a lot of the local assistance offices at Caltrans. Want to give our own email for non-infrastructure questions a plug. That's atsp@cdph.ca.gov. Let us know if you want to know more about some of the programming that Megan mentioned today. We'll get you links to those resources. Just a reminder that if you're looking to learn more about the Active Transportation Program, there's some good sites. You want to visit the California Transportation Commission's ATP guidance. You can also see who's been funded. And then finally, if you are an ATP awardee, you know, we just always want to remind people that there's a lot that Caltrans Local Assistance already has on their website if you haven't already gone there, just to know what's required from an accountability standpoint. Next slide. So thank you very much. I want to thank Leah and Megan. This has been a tremendous learning opportunity for the state, and again, launched a lot of dialogue and questions that we really hope to continue to address and be present for. So on that note, I want to thank everyone back on behalf of the HRC, my colleagues, Marianne, Emily, and Val, who are in the room with me. We appreciate your attendance this morning, and we look forward to having you join us on another call. Take care.